Before a patient dials your clinic's phone number, they have already made a judgment. 97% of consumers check online reviews before calling a local business. For healthcare providers, the cutoff is brutal. 72% of patients ignore a practice rated below 4 stars. And when practices fall below that line, this chart shows the vast majority of complaints are actually administrative bottlenecks, long hold times, unreturned voicemails, and billing confusion. Even world-class medical expertise is practically invisible if an administrative bottleneck prevents a patient from walking through the door in the first place. Schrock Orthopedic Center in Fort Lauderdale is a busy clinic led by Dr. Kevin B. Schrock, a board-certified surgeon with training from Stanford and Harvard. Their daily operations are a logistical tightrope. Front desk staff must triage unpredictable local walk-in injuries while simultaneously managing complex medical record transfers for seasonal patients traveling from the Northeast. This workload collides with a staffing crisis. Practices face a 40% annual turnover rate for front office staff. Those leaving cite a 50% burnout rate, buried under impossible demands, forcing them to juggle phones, paperwork, and patients standing right in front of them. Replacing that burned-out staff is harder than ever. 53% of practice leaders report that simply finding willing candidates is their #1 operational challenge. Schrock Orthopedic's pristine clinical reputation was actively being eroded by a reliance on a local labor model that had become mathematically unsustainable. When faced with slipping ratings, the standard industry reaction is to buy automated texting software to solicit positive reviews from patients. Automatically asking a frustrated patient for a review before fixing their actual experience usually backfires. You are just prompting them to document a broken administrative system in public. Schrock bypassed the local labor struggle entirely and integrated Staffingly's virtual medical assistants directly into their daily operations. Achieving a 5-star reputation requires physically fixing the operational bottleneck first, rather than just optimizing how you ask for scores. This flowchart maps the new hybrid workflow. Instead of hitting the local front desk, the invisible logistics, like answering inbound calls by the third ring and processing pre-visit insurance verifications, route smoothly to a secure Staffingly team. That remote team also executes the heavy, time-consuming administrative tasks. For Schrock's seasonal patients, this means securely guiding complex medical record transfers from Florida to New York without tying up the local office. With the phones and paperwork handled, the in-house staff is freed from administrative purgatory. They actually have the time to make eye contact and smile at the patients standing directly in front of them. These virtual assistants are highly trained healthcare professionals, including MDs, PharmDs, and licensed nurses. Staffingly assigns dedicated team members to specific practices. They learn the provider's names, the specific scheduling rules, and the unique communication style of the clinic they serve. By offloading the digital chaos to specialized remote teams, the clinic successfully restored the essential human connection in their physical waiting room. The tangible proof of this system is sitting right on Schrock Orthopedic's Google page. Look at this 5-star review left by a patient named Penelope Fields. Notice what is missing from her review. She makes no mention of the prestigious Stanford-trained surgeon or her actual clinical outcome. Instead, she specifically praises a staff member named Sal for flawlessly executing her New York medical records transfer. Sal is a Staffingly virtual assistant operating remotely. Penelope had no idea she was interacting with an off-site team member. She just knew her request was handled perfectly. Patients do not distinguish between in-house staff and virtual assistants. They only measure the friction or the ease of their personal experience. This search interface reveals a hidden local SEO advantage. When patients mention specific staff members and administrative tasks by name in 5-star reviews, Google's algorithm pushes the practice to the very top of local search results. This hybrid integration also carries a significant financial impact. Clinics achieve up to 70% cost savings compared to traditional local hiring, completely eliminating the overhead of benefits and paid time off. Using virtual assistants in this way is a direct investment in practice growth and patient trust. Over 800 forward-thinking healthcare providers have already adopted this exact model to eliminate burnout and close care gaps faster. Healthcare providers need to focus entirely on patient care. Let Staffingly handle the operational chaos. Focus on care. We handle the rest. Call 800-489-5877.